100%. It is a business. Patient over profit and not profit over patient. What is up, everyone? Welcome back or welcome to my channel. My name is Laurie if you are new here. In today's video, I wanted to talk a little bit about a news report that was brought to my attention actually by one of my coworkers. I'm gonna let you guys watch this video and then I'll give you my take on the video.
Dean Blackburn's son Chad was having an asthma attack.
He says, I think I'm gonna die. And I said, not if I have anything to do with it. And then his heart stopped.
Dean says he immediately started CPR on his 34-year-old son. That was on November 26th. Chad was rushed to Oakwood Hospital where he was intubated and sedated. He's been there ever since. He suffered brain damage and the loss of his fine motor skills. Dean says their neighborhood urgent care in Lincoln Park is partially to blame. You see, Dean says prior to collapsing at home, Chad had gone to the nearby urgent care because he couldn't breathe, but he was turned away.
But I guess he had a little bit of an infection in his lungs, so his inhaler was not working. Nebulizer was not working, so he come up here to the urgent care clinic to seek help. They said, your insurance is inactive, so we can't treat you unless you have $100.
Dean says Chad didn't have the cash, so he went home and did another nebulizer treatment, which didn't work. A doctor at the urgent care tells Fox 2 they have protocols to treat anyone in distress regardless of ability to pay, so they are looking into what happened.
All right, so the video is 2 minutes long. I cut it off at like 1:30. I will link the video down below. The first thing I want to say is this is really sad, and I really hope that this young man make a remarkable recovery, and I hope he's doing well. I don't know how he is doing. I actually went to go check on the GoFundMe because there is a GoFundMe for this patient. I'll link it down below if you guys want to donate to his GoFundMe. Sometimes they'll update how the patient is doing on the GoFundMe, but there's no update. It just kind of tells the story of what happens to him. Now, the reason why I wanted to talk about this is because I am a nurse practitioner. You guys, most of you guys know that. And I also work in an urgent care setting. This is my second year working in an urgent care setting. And healthcare right now is in shambles. This is America. And even though the healthcare here is better than other places, for American standards, it's kind of a mess. First thing is first, there is a lot of chatter that I have seen or my friends have seen that says that the person at the front desk needs to be fired or the patient needs to sue the urgent care. I do want to tell you guys this. The people that work at the front desk are folks that are employees of a business and they're doing what they are told a lot of the times. Now, I will say that this is healthcare, and if this patient walked into this clinic in distress and they did not assist him, that's a problem. Remember that word, distress, because even the news media, in the news coverage, when they reached out to the urgent care, one of the things that they said was they have protocols in place for any patient that walks in there in distress. Urgent care is not the ER. Sorry to say it. A lot of people do think that urgent care is the emergency department. It is not. And urgent care wants their money up front. Healthcare is a business, guys. 100%. It is a business. And they want their money up front. So just like this young man walked into this clinic and his insurance happened to be inactive, he has to pay the upfront fee to go to the back. Their upfront fee is $100. Now, depending on what urgent care you work in or what state you live in, the fees are different because in Michigan, it ranges from $75 to $255 just for you to go into the back. And then once you go into the back, everything is a la carte. So you want a COVID test, $50. You want flu, $60. You want an x-ray. What body part do you want the x-ray? Because depending on the body part, it's different prices. So you want your ankle, you need your knee, you need your, you guys get the drift. I'm just throwing out numbers because I don't think those are true numbers. I kind of want to go back to the whole, did he walk in the place in distress? Because if this patient walked into this place with full-blown distress or in any distress, full-blown or not, let me take that back, and they kind of ignore that, that's a problem. 100% that's a problem, because it doesn't matter what your boss tell you. At the end of the day, we're human and we should be here for the betterment of people, right? And I've had this happen where patient walk in and they were saying that they're having chest pain and they're having shortness of breath, and we just kind of bypass the check-in, and the patient, we just ask their name and they just kind of put them in a room while checking blood pressure, vitals, different things like that. Now, we don't know if this patient walked in here in distress. So I think a lot of the point that is missing, where a lot of people are saying sue, just sue, just sue, we also have to take into consideration, how did the patient present? All right, this is Editing Laurie, and I forgot to say this. Part of what I am also seeing is that the complaint is, if they had just checked his oxygenation at the front, they could have saved him. But checking his oxygenation, this could be yes or no. His oxygen could be pretty much normal, or it could be low. So in hindsight, should they have checked his oxygenation? Probably, at least just to say, okay, let me just put this pulse ox on your finger and see what your oxygen is, and depending on what it is. But I also will say, if that pulse ox had come back at 100%, that would also give him this false reassurance that he is okay, and he is kind of still bypassing how he's actually feeling. Because I've had patients who walk into the clinic and we check their oxygen, and their oxygen is 82%, which is low, and they said that they feel fine. And I have patients that walk in and their oxygen is 100%, and we do a chest x-ray and they have full-blown pneumonia. So just by saying, oh, they should at least check this oxygen, this actually can be a hit or a miss. I kind of really wanted to say this. All right, let's get back into the video. It sounds insensitive, but it's really not, because even though the urgent care is not the ER, it's the same thing that we do. If you're in distress, we're taking you in right away. If you're not in distress, they're going to ask you the same protocol. You're going to get checked in. What's your name? What's your date of birth? Do you have insurance? And then they find out that his insurance is inactive, and he has to pay that $100 fee. He's unable to pay the $100 fee, and they're saying, well, I'm sorry, we can't see you. Now, after all of this, the patient went home. Even though he says that his nebulizer at home is not working and his inhaler at home is not working, the patient went home and then collapsed at home. This right here is sad. And one of the reasons why I think this young man went home is because of the cost of healthcare. Healthcare is expensive, you guys. It's expensive. But it's sad, because if he was unable to pay $100 at the urgent care, his ER bill is going to be extra. It's going to be gigantic, right? Last week I had a patient who clearly needed to go to the emergency department. I spoke with him for a very long time about him going to the ER, and I wanted to send him to the ER via ambulance because of what was going on with him. And the patient was there with their spouse, and even the spouse was in agreement, but the patient was adamant that no. First of all, patient did not want to go. Second of all, then he said, okay, you've convinced me, I'm going to go, but I don't want you to call EMS. And it's because of the cost. The cost. $20,000 the last time he was transported from his home to the emergency department via EMS. That's what he told me. So this is a bigger problem than just firing the employee that's sitting at the front. At the end of the day, everybody have a responsibility to play in their own health. And the healthcare system in America is making it hard and difficult for folks to take full responsibility for their health, 100%, because they're afraid of the price, and then they end up in these dire situations. I don't know how we're going to get better, but we need to go back to patient over profit and not profit over patience when it comes to healthcare in America. All right, guys, that is it. Let me know what your thoughts are on this video. Let me know if you like this style of video. Thumbs up the video so that it can reach other people like you who would like to get into this discussion. And I'll catch you guys in the next video. Bye, guys.